Okay, so the first test we're going to do is the Achilles test, which is called the Thompson test. And for this one, I have the athlete sitting backwards, so her leg extended and her foot hanging off the edge. And so for this one, I simply just squeeze her calf, and then if she had an injury to her Achilles, there wouldn't be any plantar flexion movement, or there would be a reduction in that movement. And so the next one is plantar fasciitis tests. And so the first one is just called plantar fasciitis test. And my athlete's gonna turn around and sit with her leg extended. And for this one, I'm just gonna palpate the central band of the plantar fascia, and then also palpate the calcaneal tuberosity. And if she has any pain with this, that would indicate plantar fasciitis. And then the second plantar fasciitis test is just called the windglass test. And for this one, I have the athlete sitting in the same position, so her leg extended, and I'm going to dorsiflex her toes. And if she has any pain with that, that would indicate plantar fasciitis as well. And so the next one is called Homan sign, and for this one, the patient is sitting supine with her leg fully extended. And for this one, I have to dorsiflex the ankle and then palpate the calf muscles. And if she has any pain with this, that could indicate that she has deep vein thrombosis, and I would have to refer her immediately. And so the next test is the lateral squeeze test. And so for this one, I need her foot on the table. So, okay, so yeah, you can sit like that. There you go. And so I have a patient sitting like this with the foot flat on the table, and all I do is squeeze her foot. And if she has any pain, that would be a sign of Morton's neuroma. And so the next test is called the axial pressure test. And for this one, I have the athlete sitting with her leg fully extended. And all I do is put pressure on the third web right here. And if she has any pain, that would be a sign of Morton's neuroma.